This is the introduction of encopresis, also known as elimination disorder. Encopresis is essentially a repeated passage of feces in inappropriate places, such as on the floor or in clothing. The passage is involuntary in nature. It can be intentionally in some cases. If the passage is involuntary, it is often related to constipation, impactation, and retention with a occurring overflow. Symptoms of encopresis. There are a number of key symptoms to keep in mind in the diagnosis of encopresis. Included in the list are the following. 1. Occasional passage of very large stools. 2. Secretive behavior with the act of having a bowel movement. 3. Inability to retain feces, bowel incontinency. 4. The passage of stool in inappropriate places. 5. Constipation and or hard stools. Diagnosis criteria. According to the DSM-5, there are 4 features that must support a diagnosis of encopresis. 1. A patient's chronic age must be at least 4 years of age. 2. A repeated passage of feces in inappropriate places can either be intentional or involuntary. 3. At least one such event must occur every month for 3 months. 4. The behavior is not attributable to the effects of a substance, for example, laxatives or another medical condition, with the exception of a mechanism involving constipation. In making the diagnosis, it is critical that the clinician specify which of the following is present. With constipation and overflow incontinency, through physical examination or medical history, there is no evidence of constipation. Without constipation and overflow incontinency, through physical examination or medical history, there is no evidence of constipation. Whenever possible, a parent should complete an encopresis frequency calendar to help clarify the frequency of any associated symptoms. As part of the history, it is critical to assess the mental status. For example, what is the child's level of distress concerning encopresis? In order to make a definite diagnosis, a complete medical examination must be conducted. Features of this exam must include gait, abnormalities, general strength, reflexes, coordination, abdomen, and presence of stool masses, discomfort, and rectal examination for tone and presence of impactation. Lastly, some laboratory assessments as well as imagining modalities may be required. It is estimated that about 1% of 5-year-olds have encopresis, and that the disorder is more commonly observed in male than in female. It can be properly diagnosed until a mental age of 4 years have been reached. Risk factors. Although every case is different, a number of risk factors are known to be associated with the development of encopresis. Examples include abuse or neglect, diet that is rich in fat and or sugar, inadequate water intake, presence of chaos or in the parent's life, lack of physical exercise, refusal to use the bathroom, especially public bathrooms, presence of a neurological impairment, history of constipation or painful defecation, cognitive delay such as autism or mental retardation, presence of that's long enough. How long is it?
No,
How long is long? How long?
It's 6 minutes.